Bismillahirrahmanirrahim. Today we will discuss the ultrasound features of metastatic lymph nodes, especially the lymph nodes which shows metastasis from thyroid neoplasia or cancers. When we are discussing the features to assess a lymph node, the following features to be included: the size, shape, borders, echogenicity of the lymph node, one important sign which is Hilus sign, necrosis, especially intranodal necrosis, calcifications, and vascularity. Lymph node size. The larger the size of the lymph node has higher risk of malignancy. But we should be careful that reactive and metastatic lymph nodes can be larger. There are different school of medicine that considering the size of the lymph node as large. 5 millimeter, 8 millimeter, and 10 millimeters are considered as cutoffs of sizes. Lymph node size follow-up is always useful. If the size is increased, it shows that the carcinoma is highly suspicious for the metastasis. If the reduction of the size is observed, it shows a good response to the treatment. The second feature of the lymph node is its shape. Metastatic lymph nodes are spherical, and the ratio of the short to long axis or the ratio to the long to the short axis is changed, or we can say that the shorter diameter is elongated, so the ratio is coming toward the 1. Eccentric cortical hypertrophy will be seen in the metastatic lymph node. We can clear that hypertrophy is irregular due to the infiltration of the tumor. One thing that we should take care that submandibular benign and reactive lymph nodes are also often oval to spherical. These slides show metastatic lymph nodes. If we see, the lymph nodes are irregular, taller, and hypoechoic. Next feature to be considered that is the border of the lymph node. The metastatic lymph nodes have sharp borders. In advanced stages, the borders are becoming ill-defined, and this indicates extracapsular spread. Echogenicity is the next feature. Metastatic lymph nodes are predominantly hypoechoic. Metastatic lymph nodes from papillary thyroid cancer are usually hyperechoic. This is one exemption. The popular sign, which is called Hilus sign. If the Hilus sign is present in the lymph node, it will be considered as benign. It's present in almost 90% of the nodes with a diameter greater than 5 millimeters. Echogenic Hilus may be found in some malignant lymph node. Therefore, it is not an absolute sign that the presence or absence of this Hilus to be considered as a sign of malignancy or benignity. This is the lymph node which shows centrally located the Hilus sign. So this node is considered to be benign. Another feature of a lymph node to be assessed by the ultrasound is calcifications. The metastatic cervical lymph nodes, especially from PTC, papillary thyroid carcinoma, tends to show microcalcification. The pattern of these microcalcification is punctate calcification, which is located in periphery of the lymph node with acoustic shadowing. The metastatic lymph nodes from medullary thyroid CA may also show calcification, but its incidence is very low. These are the lymph nodes which shows calcifications. This is thyroid nodule and shows a metastatic lymph node on the left. Metastatic lymph nodes, which is elliptical shape, inhomogeneous structure, the solid part, hyperdense, central hyperechoic punctuation is present, and sporadic cystic necrosis, and if we see there is no Hilus sign. Vascularity is another feature. Metastatic lymph nodes shows peripheral vascularity, while mixed vascularity can be present in hilar and peripheral regions, and this is disappeared at later stages of malignant process of the lymph node.